Good evening, everybody. Welcome to the Health Library's first program of 2021. I'm excited tonight to be able to introduce you to a wonderful topic, living better with prediabetes. This is part of our Living Better series, which we've had great success with and is really the brainchild of one of our speakers tonight, Dr. Randall Stafford. Before I introduce Dr. Stafford, I would like you to know that you can submit questions for both of the speakers tonight, really at any time that you want, just using the Q&A tab down at the bottom of your screen. And Dr. Stafford will moderate the questions after both of them have finished with their presentations. Dr. Randall Stafford is a professor of medicine here at Stanford School of Medicine, and he's also the director of the program on prevention outcomes and practices. In addition to his research focus, Dr. Stafford is a primary care physician in the Stanford Internal Medicine Clinic, where he focuses on chronic disease prevention and treatment. He serves on expert committees advising a diverse range of organizations, including the California Medicaid Program, the National Committee on Quality Assurance, the American Heart Association, and the American Journal of Preventive Medicine. I could go on and on. His CV is really long, but it's probably just better if I turn it over to him now and he can take the program away. So welcome, Dr. Stafford.
Thank you so much, Nora, and it's really great to be here. We're going to be talking about living better with prediabetes. And as Nora said, this is part of a series of talks and interactions that we've planned out under the general umbrella of living better with chronic disease. And when we talk about living better with chronic disease, the sort of things we're really insistent upon are that patients really become the center of their own care. And this requires gaining some skills and gaining some knowledge that not all patients will necessarily have at the beginning, but acquiring those skills and that new information is critically important to managing and helping to manage the process of your own healthcare. We've had past sessions on coronary artery disease, heart failure, and atrial fibrillation. We also have plans for future sessions, again, focusing on the theme of living better with a chronic disease and the role that patients themselves should play in terms of improving their outcomes and improving their quality of life. Today, we're going to be talking about prediabetes. Prediabetes is a very important both condition and concept. There are numerous people in the United States who have diabetes. There are even more people with what we often call prediabetes, which are the metabolic signals that suggest that diabetes is on its way. And there's a lot we can do to manage prediabetes, both as a condition and as something we want to focus on to prevent the development of full diabetes. So today I'm very happy to be joined by Leah Groppo. And she is a dietitian here at Stanford, actually both a clinical and research dietitian. And she's gone through extensive training to really know the patient angle about food and diabetes. Her education includes going to Cal Poly as well as Arizona State. And she is a certified diabetes care and education specialist. So I'm very happy to have her here with me. Just a little bit about what we're going to do today. Leah's going to start out talking a little bit about background information on prediabetes. That should provide a foundation for further discussion. And we hope this really will be a discussion rather than a lecture. I will follow Leah's brief talk with a few comments of my own, mostly from the perspective of a primary care physician who often gets questions from patients about how to prevent diabetes and how to prevent prediabetes. I also feel that it's my role to kind of play the patient advocate and ask those difficult questions that sometimes I get as a primary care physician that I can't always answer. and I'm going to be throwing some of those questions, of course, at Leah. I may try to answer a few questions of my own. After my very brief comments, we're going to open this up, and it's really going to be about questions from the audience. And I know that we already have a few questions already. I want to encourage you during the talks to start thinking about your questions and even enter them in the Q&A function within Zoom. So without further ado, I'd like to have Leah take over and tell us a little bit about the foundation of prediabetes.
Thank you so much, Dr. Stafford. It is so great to be here tonight and to get to meet all of you, I guess, joining. So today we are going to talk about living better with diabetes. So my name is Leah, and I really devoted my career thinking about diabetes, blood sugar, pre-diabetes. So hopefully we can, at the end of this, answer your questions and have a great chat, not a lecture. So this will be brief. But really, what are we going to talk about today in this brief section? So I'm really going to talk about what's going on in your body when you're diagnosed with something like pre-diabetes. How does food, how does activity affect your blood sugar? What are different foods maybe that you want to increase in your diet to help lower your blood sugar? And then also, what are those foods that maybe are more blood sugar spiking, especially foods that maybe a little bit more you're not sure about, or is that a healthy food or a food that might spike your blood sugar? And then again, like, how do we lower our blood sugar? So that's the main focuses for this section. So there are risk factors. So we have two different buckets, right? We have the non-modifiable risk factors, so the ones that we can't change, the ones that we can't spend time really to change because they're non-modifiable, we can't change them. And then we have those modifiable risk factors, the ones that are actually in our control, what we can do. And so these are the ones we're really going to focus on today to really think about ways to lower our blood sugar that we have control over. So specifically the ones like thinking about a healthy weight, thinking about the portion sizes of foods we eat and what we eat, thinking about our activity and our movement throughout the day, planned or not planned, thinking about stress. So stress can also definitely raise blood sugar. So how are we dealing and managing our stress, especially during this time? Thinking about the quality of our sleep. So sleep actually can also affect our blood sugar. So if we don't really get a lot of it, can raise our blood sugars. And then also managing other things like our cholesterol numbers, our lipid numbers, and our blood pressure. So those are really the things that we're going to focus on more today because those are what we call our modifiable risk factors. We have control over them. So when we kind of background want to think about blood sugars, what puts us into the prediabetes range? So prediabetes, if we get a fasting blood sugar, typically between 100 and 125 would be considered prediabetes, or a hemoglobin A1c of 5.7 to 6.4% is that prediabetes category. So on either end, we have the no prediabetes, euglycemia, normal blood sugars on one end, which I've listed, and then the ones when we end up in the diabetes category, so our blood sugars are rising. So blood sugars are above 126 fasting, or hemoglobin A1c of 6.5 or greater. So in general, for a diagnosis, we want to see 2 in those diabetic ranges before diagnosing. So what helps? So that is why we are all here today, right? We're learning about our health. We want to be in charge of our health. We want to be at the center of our health. We don't want people in white coats the center of our health because it's most important to us. So what can we do? Well, research really strongly suggests that if indicated, losing 5 to 10% of total body weight can really help sensitize our bodies to our own insulin and can really help us to lower our blood sugars. So a lot of people, when they think about this, it's not that crazy 50-pound weight loss or 80-pound weight loss that you see on TV shows. It's really looking at maybe 10 pounds, 15 pounds, 20 pounds over 6 months of time. So it's not this crazy crash diet. It's January, let's get on board and really eat 800 calories and lose 20 pounds in 2 months. It's not that. It's a long-term investment in your health, slow, steady weight loss, maybe 1, maybe 2 pounds a week over a long period of time. Also, we can reduce our processed food intake. So I'm going to talk a lot more about what is a processed food, because I think that as a dietitian is so important to understand. So reducing processed food intake, and then moving. So trying to move throughout the day, planned movement of 150 minutes at minimum per week. So 5 days, 30 minutes. At least 2 of those resistance training. So something that you feel your muscles working. So it could be resistance bands. It could be trying to get some marching in place that's really using your muscles a little bit more. It could be 2-pound weights, 5-pound weights, all those things that utilize your muscles more than just walking on a flat surface. So those are really the 3 things that research really has identified to kind of help lower blood sugar. So I think it's really important also to note, so BMI is body mass index. And so I know it gets a really bad rap sometimes, but it's kind of just an easy way to sort of think about where we fall on the trajectory of what our goals will be. So for example, like I mentioned, the 5 to 10% weight loss, if you're in the normal BMI, I would say we want to focus more on doing those resistance training, building muscle will be more helpful for lowering blood sugar. If we're in the overweight or above category, we want to think about that 5 to 10% weight loss. It's important to note that the World Health Organization now really notes that people of Asian ethnicity actually are recommended to be at lower weights because we get prediabetes, diabetes, heart disease, hyperlipidemia at lower weights than our counterparts in other ethnicities. And so that definitely needs more research, but I have a category if you're of Asian ethnicity and then if you're not. So when we're really thinking about what is going on with this concept called insulin resistance. So this is really what's going on in our body and really one of the core things that has to do with prediabetes and type 2 diabetes. So we have different organs. So we have this organ called the pancreas. And so your pancreas actually puts out this hormone called insulin. Insulin is this hormone that helps you bring sugar into your cells that you need. So like your muscle cells, your brain cells, different cells in your body. So what happens, normally your body puts out insulin based on food that you eat. The insulin is in your bloodstream. The sugar, the glucose is also in your bloodstream. The insulin goes and attaches to cells. So if you look at this little green dot, it's attaching to this receptor on a cell. When it attaches, the cell opens the door and lets the sugar in, specifically glucose. So without this process, or if there's dysfunction in this process, we end up getting higher levels of sugar in the bloodstream because we're not as able to have those insulins connect the receptors to let the gate open. So if there's no connection, there's no glucose that can flow into those muscle cells where it needs to go. So if we look at the second one, looking more at insulin resistance, so your pancreas is putting out insulin, insulin is in the bloodstream, glucose is in the bloodstream, your little insulin receptor is either not looking quite right to attach with the insulin, so it's like almost like a sticky key, you put your key in the door, it doesn't quite open the door all the time, or you have less of those receptors on your little muscle cells. So thinking about processed food. So this is kind of my slide that I created to really define what is processed food. So if you're at the store, if you're ordering groceries, how do you decide if something is processed? So I think corn is the perfect example because we have learned how to process corn very well. So it has a lot of stages of process. So if we look at the first, so a whole piece of corn. So if we went out, we looked at this at the store, 100% of us, I think, could all say, hey, that's corn. We see it, we see the corn kernels, it's actually in its husk. And then if we move down, the cornmeal. So if we were all in person, I were to show you all cornmeal and say, hey, are you 100% certain that this is made from corn? We probably would not all agree. It looks kind of yellow, looks kind of like corn, but it's more processed, so we really can't tell if it's made from kernels. And then if we keep going down in the process continuum, corn flakes. If I were to show you all these flakes, would you say 100% that is made from corn? It could be millet flakes, it could be quinoa flakes, it could be wheat flakes. So when we think about this specifically, it's even more processed. And then finally, if we look at corn syrup, so we look at the syrup, if I show it to everyone, it could be syrup from a lot of different things. It could be honey-based, it could be corn-based, it could just be sugar, cane sugar-based. So there's a lot of different things. So that's really how we tell, is something processed? So if you look at something and you say, hey, that looks like something Mother Nature made, I can tell what it is, I can identify pieces in it. If you have a chili, for example, you can see the beans, you can see the pieces of veggies in your chili. So those are not processed. If you get a muffin and someone tells you it's a bean flour muffin, but you don't see any beans, that would be more processed. And so when we think about this concept of process, I always want you to think about the food companies or the mills or the processors are doing the work of your mouth and your digestive tract. So when something's made into flour, your body doesn't need to chew it as much. You don't need to, it's easier to digest, and easier seems like a good thing in most parts of our life, but easier when we talk about digestion is not better, because easier means more blood sugar spiking. Your body is able to get access to those carbs and that sugar and convert it super fast into glucose, and it can hit your bloodstream in a faster way than your body can compensate and lower. So here are some different examples. So if you are eating more processed food, the column on the left, if you're looking at the screen, so your white rice, white bread, pasta, things like that, here are some examples that are a little bit less processed. So if you look down and you have a bowl and it has quinoa in it, you can say, hey, I know what that is, that's quinoa or brown rice. And it's in its most close to Mother Nature made form as possible. White rice is less like you would buy, get it from the fields. So it's more processed. When we think about sugars, we want to think about getting in maybe fresh fruits, whole fruits, enjoying the sweetness from that versus more processed sugars. When you think about proteins that are high in saturated fat, lots of marbling, because we know that with prediabetes, we also want to be really mindful of our heart and our lipids as well. We have some leaner protein options, and then even maybe challenging your family or yourself with maybe a meatless Monday, maybe where you don't have an animal protein at a meal or a day could be another thing. And then also thinking about saturated fats versus liquid fats would be another option. So liquid fats are healthier for your body. And then snacks that are very processed, like cookies and pastries, things like nuts, seeds, low-fat yogurt, avocado, things like that, and really enjoying those flavors. So this is something that I went to a big conference that was focused on diabetes, an international conference. And this is a study that most stood out to me out of all the ones that I went to. So really, I'm going to show you 3 different meals, and I want you to think in your mind what you think is happening in your blood sugar. So this was a study with people who are living with type 2 diabetes, only on an oral medication called Metformin, and they came in 3 different visits. And they were asked to eat these foods. They were monitored that they finished the food. So they had lab monitors and they made sure they ate the foods within the time frame. So in 10 minutes, they waited 10 minutes and then they ate the second part. So in visit 1, they had focaccia bread and orange juice. 10 minutes, they waited 10 minutes and they ate a big salad, no dressing, and chicken. Visit 2, so then they ate the same portion of salad and chicken, waited 10 minutes, and then ate the same portion of the bread and the juice. So portions are not changing, carbs are not changing. And then finally on the third visit, they ate it kind of like a mixed meal. So they had a sandwich and half a juice, waited 10 minutes, and then the other half the sandwich. So if we think about this, a lot of people I think would not maybe be sure or think there was no change. But when we look at the graph, so the each meal correlates to the number. The blue, or the salad and lean protein before, waiting 10 minutes, and then the carbohydrates, yielded a lot lower blood sugar. So there is this idea that putting in these non-starchy vegetables and some lean proteins before we dive into our main meal may be beneficial in keeping our blood sugars lower. So it's just something that I think we're going to learn a lot more about as time goes on and more people fund these studies, but it's something I think is really interesting. The one other point I want to make, if I was designing the study, which I was not, I would actually not have the juice, because I think if we look at that third visit, the mixed meal, I think, would have yielded a lower glucose profile. But with the juice, you see the blood sugar spike very similar to the first meal. But I think if we took the juice out, you would see a more, the yellow would stay very similar, the blue would be the bottom, and the green would actually be really in the middle from that mixed meal. And then, so finally, thinking about how does activity affect our blood sugar? So activity in general, a lot of people say, I'm going to start walking. Activity doesn't actually normally yield weight loss. So I think that's an important point to make. But activity does wonderful things for our blood sugars. So when we're active with planned activity, 30 minutes or more, for the next 24 hours, we're going to have lower blood sugars. I can just pause and let that sink in. 24 hours. There's not much we can do in our life that yields such a strong benefit. It also sensitizes your body to your own insulin. So like if we look back at that picture that I had before, I just put out the muscle cell, just that part of the picture. When we exercise, the little insulin receptor, the GLUT4 receptors, actually are prompted to mobilize from inside the muscle cell to the cell membrane. So now, instead of having this muscle cell that really doesn't have a lot of ability to facilitate sugar into the cell, you have double or triple or quadruple the ability to facilitate sugar into the cell, because now the muscle cell is saying, we need more energy, we need more sugar with your activity. So actually changes the playing field of the insulin resistance and lowers. And then finally, it just uses those glucose that's already stored in the muscle cell. Once sugar enters the muscle cell, it stays there until it's used. There's no two-way channel in the muscle cell. It's only one way. Sugar only goes in. And then this is just my last slide. Finally, I think we're going to talk a lot about this, but we really want to empower you. So you are the expert in your own life, and I strongly believe this. So working with a lot of people, if we create goals for people, they never get done and they're not helpful. But when you create your own goals, they tend to get done, because who is expert in your own life? You are, right? I don't know what your daily life looks like. I don't know your family life, if you have kids or if you don't. I don't know what's reasonable for you. And that changes by everyone. So I think that at the end of this presentation, I'd really just encourage you, challenge you, whatever works for you, to think about setting one goal that's specific, a SMART goal, one goal that's measurable. You can tell if you've achieved it. One goal that is action specific. So not like, I want to lose 10% of my body weight in 6 months. That doesn't really tell us how we're going to do it. We want to say a goal, maybe something like, I want to reduce my carb portion with dinner 3 days a week, Monday, Wednesday, Friday. And I'm going to measure it by comparing it to my fifth. Super smart. We know exactly if we're going to meet it or not meet it. Is your goal realistic? Maybe that is only one night. Maybe you're going to prep one meal on a Sunday, and you're going to try to enjoy that meal and see your portions. And then also have a time limit when you want to think back and address that. But really thinking about whatever goal that you set today, something you can start even tonight or something you can start tomorrow. You don't want to create goals that you think, oh, it's going to be better in February. I'll start this goal in February because that's what I need to do. You want to make it so realistic, you could start tomorrow. So with that, that is just the end of my presentation, and we will continue moving on.
Thank you so much, Leah. There was a lot of information packed into there, and I hope we have a chance to unpack some of that and to go into more detail. So in terms of prediabetes, what we're talking about is a condition that comes before people develop type 2 diabetes. And it's very important to understand that with type 2 diabetes, the issue is that people's blood sugar is getting too high at the same time that their insulin levels are getting too high. Now, part of this, as Leah was describing, has to do with this process of insulin resistance. Our cells, particularly the liver and the muscle cells, don't respond to insulin in a normal way. So that usually, as Leah was talking, the cells of our body are triggered by insulin to start taking in blood sugar out of the bloodstream. When that doesn't happen, a couple of things occur. First of all, that blood sugar is not removed from the bloodstream and it starts to go up. And with that increased blood sugar, the body senses that it has too much sugar and it tells the pancreas to crank up or increase the amount of insulin that's being put into the bloodstream. So it kind of becomes a vicious cycle that the blood sugar goes up, insulin is released from the pancreas, it doesn't have its intended effect, and so the body needs the pancreas to work harder to produce even more insulin. Now, with prediabetes, the body is actually able to overcome that insulin resistance simply by putting out more insulin. What sort of distinguishes prediabetes from diabetes itself is that once you have diabetes, blood sugars are going to be high regardless of how hard the pancreas is working. Now, this is a continuum, and people can have very mild problems with processing sugar or carbohydrates, and it can then develop into prediabetes. That prediabetes can develop further and eventually can become diabetes or type 2 diabetes. Now, the great thing about prediabetes is that by and large, it's reversible, because if we can somehow sensitize those cells to be more triggered by the insulin in our bloodstream, this whole process can kind of move backwards in a reverse direction. That isn't necessarily true once people develop diabetes itself. So I want to make this point that prediabetes is a really important decision point for people, because this is when you have the ability to make a true difference in terms of your health. That ability isn't necessarily there to the extent once you develop the diabetes. So again, a lot of the issue here is that we want to be able to take control of this condition when it's controllable. So I wanted to follow up on Leah's comments by just presenting a little bit of my own ideas about how to successfully deal with prediabetes. And these are tips for managing prediabetes that in many ways apply to many other conditions and many other behaviors other than diet. We do focus particularly on diet, but diet is only part of dealing with chronic disease and actually even only part of dealing with prediabetes. So a couple of the important things are that we need to control unrealistic expectations. This isn't about getting back to the weight you had when you were 21 years old. This is about losing a particular fraction of your weight, and often 5% weight loss makes a considerable difference. Some people may need more than that, but being realistic. Part of being realistic is also realizing if you start down a change in behavior, it's almost inevitable that you're going to fall off the wagon at times. And so the important thing is to recognize you just have to pick yourself up and get back into the plan of of managing your prediabetes. I think it's really important that people focus on identifiable behaviors. That is, things that you can know that you've done or not done. So that would be reducing the portions of carbohydrates, eating more whole grains, eating more fibrous vegetables. Also, physical activity. I did this many minutes of moderate physical activity. Unfortunately, weight is not a good measure because weight changes very slowly and is subject to all sorts of other variations that really have nothing to do with our behavior, whether it's the time of day, how hydrated we are. So I tend to tell people, focus on what you eat, how you sleep, how much physical activity you're getting, rather than focusing primarily on weight. Now, even if we do focus on weight, the first priority is to maintain weight. A lot of people that are in the prediabetes category have a pattern of over time gradually gaining more and more weight. The first step is really to put an end to that and to have flat, stable weight over time. As Leah was saying, it's really important to set your own priorities. You're the person who has this condition. You know best what's going to help. You know best the things that will be satisfying or unsatisfying. And it's really important that you articulate this with physicians or with dietitians. Now, a good physician and a good dietitian, they will ask you what you think is important. They'll help guide your own values and priorities into a plan. But unfortunately, we're not always have the ability to have people with such an outlook. And there's still a lot of paternalism in healthcare where basically doctors are able to say, you do this and you do that. But I've found in my own practice that doesn't necessarily work as well as putting patients in the center of the planning. There's a lot of things about diet which sound like restrictions. You know, eat less calories, use smaller portions, reduce your saturated fat intake, reduce your sugars. But it's important at the same time to encourage consumption. And as I said lower down here, you can really never go wrong increasing fibrous vegetables. Vegetables like broccoli, asparagus, artichokes, cabbage, carrots, a whole list of things. Now, what's going to be important for many people is finding one of those healthy vegetables they really like. And for that situation, I say, you know, eat more. It's not just about restriction. A simple diet is usually better. If it gets too complicated, then it's hard to follow on a continuing regular basis. A complicated diet, you may be able to follow for several weeks or even several months, but the more complicated it is, the more difficult it is in the long term. I also would say that diet by itself is rarely enough. Although the number of calories we take in and the type of calories we take in is enormously important, we really need to think about other strategies like sleep, stress reduction, and physical activity, which also have benefits in terms of prediabetes. And in fact, this is a good time for me to bring up this idea that diabetes is one of several diseases which seems to be mediated or is caused by inflammation in our bodies. And things that we can do to reduce that inflammatory response, which in part is making our cells more resistant to insulin, anything we can do will be helpful. And in fact, it's been shown that not only is a heart-healthy diet improves the inflammation, that is, reduces inflammation on our body, but several other things do as well, including physical activity, better sleep, and stress reduction. And so diabetes in some ways is a disease of inflammation. And the thing about those behaviors that can reduce inflammation is that they not only help with reducing the occurrence of diabetes or treating prediabetes, they also help with things like coronary artery disease. Dementia may have some aspect that's inflammatory. Cancer also is very often has an inflammatory process. So these things we're talking about are important for prediabetes, but they also have so many other effects beyond there. I also think that it's very unrealistic to completely avoid your favorite foods. And what I tell people is anything it should be on the table as long as it's in moderation. So the idea of having a little bit of dessert is fine, particularly if it's going to make your diet satisfying enough to stick with long term. One thing that Leah does universally is you can't just talk about food with the person eating the food. You have to talk about food with the person preparing. And, often this is the woman, not always. And there are plenty of couples where both people cook. But it's very important to focus on food preparation, not just on the process of eating. And then we are likely to get a lot of questions about different diets, different popular diets. And even though these diets seem like they're very different from one another, let's say the Ornish diet or the Atkins diet or some of these other, let's say the South Beach diet, even though they are different in many ways, all of them have in common this idea that we're going to reduce simple carbohydrates. So this idea of focusing on a particular part of the diet, those simple carbohydrates, that's probably where the greatest return is when you think about the effort required to change your dietary pattern or dietary behavior. So that's all for our introduction, and I want to be able to go into more detail in terms of the questions. And to do that, I need to figure out a little bit more how to run my computer here. Let's see here. We already have a few questions coming in, and I'd like to encourage everybody to go ahead and continue to put those questions in. I will tell you that I probably will be combining some of the questions here and there, and I won't necessarily be going in direct order because I am going to combine some of these. But the first question is a really great one, and this has to do with the microbiome. And so maybe Leah could make a couple of comments about the microbiome and its relationship to disease. But I can tell you that this is an area of increasing research. The idea that the bacteria and even viruses that live within our gut are important in terms of how our body deals with different foods that enter our system. Leah, what do you have to say about microbiome?
Yeah, I think that this is such a great area of new research. And there are some preliminary studies that are looking at the health of our gut biome. So the little bugs that live in our body and our gut, the health of them has to do with how we metabolize and utilize some certain carbohydrates. So are we more effective or are we less effective? So there's a lot of really really research around this. But I think that to not get too complicated, what helps feed our gut biome? Fiber. Fiber helps feed our gut biome. Where is fiber found? Non-starchy veg. So the cabbage that Dr. Stafford was talking about, the asparagus, the artichokes, all of those things, beans and lentils, all those high fiber, whole foods, non-processed, really amp up our gut biome because they're actually doing some more research and looking at probiotics, so the pills that we take that have the little bugs, how they recolonize. And some of that research is actually really interesting. People are actually leaning more in the field towards high fiber foods to really help facilitate your own native internal gut biome, give them the food, which is the fiber, versus just trying to take all these pills because they might not be what fit for you. that are the ones that fit for you. So actually, the biggest thing you can do to help your gut biome, to help your overall health, health of your bugs, is to eat high fiber foods.
And what are some of those high fiber foods, Leah?
Yeah, so beans and lentils, broccoli, cauliflower, cabbage, radishes, green beans, all those non-starchy vegetables, whole grains like farro, bulgur, like whole wheat berries, all of those, quinoa, the list goes on. So all those ones that actually have the outer shell, so the higher fiber outer shell, like a white piece of rice, no outer shell. A brown piece of rice, a wild rice has that shell, and that's where the fiber is really found.
Great, thank you. I'm going to go to a couple of questions that have to do with the lab testing for diabetes and prediabetes. And as Leah was saying, there are really two things that we use. One is blood sugar, particularly fasting blood sugar, and that's when you haven't had anything to eat for between 8 and 12 hours. The other measure is something called hemoglobin A1c. And just a little explanation of what A1c is. Essentially, it is the molecule of hemoglobin that's in all of our red blood cells. That molecule, when it's exposed to blood sugar in our bloodstream, changes the molecule slightly. It has some sugars that actually stick to that molecule, and we can measure how many of those sugars are sticking to it, and because it changes some characteristics of the molecule. Doesn't seem to change the oxygen carrying capacity of hemoglobin, which is a good thing because we all rely on that. But as a laboratory test, we can use A1c to take a look at what the average blood sugar has been over the last 3 to 4 months. So it's almost like a moving average of what's been happening in our body, not just fasting when we haven't had anything to eat, but throughout the day, including those times when we have a meal and our blood sugar may go up a little bit, and those times when we're resting and not eating. So both A1c and the fasting blood sugar are thought of as being alternative ways of diagnosing prediabetes and diabetes. Doesn't necessarily mean that one is better than the other. There are some instances, however, where people can have a high A1c and have a relatively normal fasting blood sugar. And this is particularly true in some types of prediabetes, where most of the problem is occurring just immediately after meals. So it really doesn't matter too much which of these tests is used. And if the blood sugar is low and there are no other indicators that prediabetes may be present, then blood sugar alone is possible. However, we are using A1c more and more, in part because it's that average. It gives us a look at everything, not just blood sugar on a particular day. Any further comments on testing? Leah?
I think that I think both are great. I think that sometimes people really look at that fasting blood sugar and think about, oh, like I made all these changes and my fasting is still 105 or 110. But really looking at that hemoglobin A1c 90-day average is going to show us all those healthy behaviors that you've been adapting, because it's going to give us a really good average. So I think both can be good encouragement when we're making changes.
Definitely. And there was one question about whether having your spleen removed would affect the A1c level. And in that situation, no, the removal of the spleen would not be expected to really affect the blood sugar or the A1c. Both the blood sugar and the A1c are measures done on serum or the blood. The A1c, of course, is done on the red blood cells, whereas the glucose is just what's the level, what's the concentration of blood sugar in the blood itself. So both of those are done by going to the lab and getting your blood drawn. One downside of the fasting blood sugar is it really do need to be fasting. If you come into my office at 2 o'clock and you had your lunch at noon, there's really no way we can interpret what your blood sugar is 2 hours after you eat. It's very likely to be much higher at that time than it would be if it was, let's say, first thing in the morning where you truly were fasting. So the A1C does have that advantage. We can kind of get it any time of day, and we're less constrained in terms of how we use that. I had a couple of questions here about exercise and physical activity. And I wanted to kind of make a quick point that I really talk about it as physical activity or movement, just as Leah does, because I think exercise is a bit of an old-fashioned term. And we usually associate exercise with doing things that are exhausting and where you necessarily are working up a sweat. You can get a lot of benefits from movement, from lower level physical activity, even from walking. And so I tend to prefer saying movement because it includes lots of other things we don't even necessarily think of as physical activity, like walking to the drugstore or dancing. But the point is that we don't necessarily need a high level of physical activity or intense level of physical activity for it to be beneficial. And many people kind of lose sight of this. And I think it keeps people from being as active as they should be, again, because that low level activity is actually quite beneficial. Now, there's some new research, and I wanted Leah to comment a little bit on this. It really seems like the aerobic exercise, which is, again, regular movement of the body where the heart rate is increased, that's been the foundation of what we have been recommending. But it really looks like other types of physical activity may be really important to combine with aerobic exercise or physical activity. Leah, do you want to talk about that topic for just a bit?
Yeah, of course. I think that we're really finding the resistance training to really help lower our insulin resistance. So when we use our muscles with resistance bands or light weights, marching in place, things like that, we actually can help sensitize our body to our own body's insulin. And so that really can lower blood sugars, a hike, taking the stairs, things like that. I love the idea of movement because when we think about exercise, planned exercise, there's a lot that goes into that. Maybe you need special shoes, you need a special outfit, all those things. So to help improve your health, you need none of that. It could even be walking around your block in your flip-flops. I mean, I guess it's winter, so people are probably less likely to do that, but it could be walking your dog. It could be going for doing a couple of steps, like every time you go to the fridge or something planned. It doesn't have to be large to make a big benefit. And I think that when we get really hung up on this idea of it has to be planned, I need a special clothes for, I need to go to a gym, we end up not being as active. And so a lot of the new research shows that like the weekend warrior idea, so zero activity during the Monday through Friday, sitting at a desk, not moving, and then the Saturday, Sunday, 2-hour boot camp, sweat pouring down your face, in pain, trying to work up and make up for those Monday through Friday actually is not as healthy for you versus if you did even 10 minutes, maybe Monday through Saturday. So a block walk or 2 block walks throughout your day. So that shorter period, but more consistent is what yields you that benefit. So a 10-minute walk may not give you that 24-hour lowering of blood sugar, but it will get you part of the way there. So really just urging you to think about ways you can just fit movement in with your family, even taking your kids for a walk around the block. Granted, I know that might be a lot slower walk, but still great for your muscles and great for your body. making those plans and putting those habits in place.
Yeah, it's really important to remember that, it doesn't have to be a lot to get you started on this process. And also, there's some evidence that what we call sedentary behavior is itself a risk factor. So again, part of the issue going on with the weekend warrior is that that person is suffering from the risk associated with doing nothing for most of the week. And then that sudden burst of physical activity doesn't really doesn't fully offset that long period of being sedentary. One point I want to make, particularly for older people, any weight loss is going to result in some loss of muscle. And loss of muscle is one of the really big risk factors for bad things happening in older people, particularly those who are over the age of 80. So I always recommend that strength training, resistance training, be part of the activities that people do. And although we often think about weights as the, kind of the way we get strength training, there are lots of other ways, including, let's say, yoga, which tends to be a lot of what we call isometric training. That is, we're holding a position using the muscle, and that also will build the resistance and help with reducing the amount of muscle loss that someone has if they're losing weight. We have a couple questions here that, go ahead, Leah.
Oh, just really quick. And then I also, just to be kind of encouraging on your goals, if you're doing yoga or holding isometric, like maybe a half squat or something, measure the time how long you can do it when you start, and then measure your time after doing it for a month. See the change. Even if there's not a weight loss change, you're building muscle and you're lowering your blood sugar and you're doing something healthy for your body. Because I think, like Dr. Stafford had mentioned, weight, so many different variables that can move weight. And if we always put so much in our basket of weight loss, if I don't lose weight, it's not working, we really can get derailed off of a very healthy behavior.
Yeah, definitely. Leah, we have a few questions that are right in your wheelhouse about eating. And some of these are having to do with, should we have set meal times, eat at only distinct times during the day? Should we spread out our eating? Is eating in the morning better than in the evening? And, what do you say about, what's the best way to kind of time your meals?
Yeah, that's such a great question, and a lot of questions. So I think that this is something that has also gained a lot of research. So there have been some research studies looking at your largest meal being breakfast or lunch. So larger breakfast, lunch, lighter dinner on the carbohydrates and the fats, which can help blood sugar. Also thinking about meal timing, like this concept of intermittent fasting, you only eat over maybe an 8-hour time period. And you don't eat for 16 hours, can lower your insulin resistance. So, I think that these things can be helpful and helpful tools, but I think that when I'm working with people, it's not always something that is feasible or reasonable. So I think that we can still gain these benefits by adding movement into our life, thinking about what we're eating for meals like dinner, because that dinner meal is what's going to prompt our body for nighttime sleep and everything. So is our nighttime meal less processed, more non-starchy vegetables in that meal is going to be a better blood sugar type of meal. And then I think the biggest thing is you really have to really think to yourself, am I somebody who is a meal eater or am I a snacker? And what kinds of foods am I snacking on? If it's more like the potato chips or processed foods, maybe you want to think about changing that. But if you're truly snacking because you're hungry between meals, I would not change that. The fundamental way that you like to eat, I would not change. I would think about maybe adjusting some of those types of snacks. Versus changing, because I have had some patients who come and they really want to do intermittent fasting, but it's just not feasible in their life. So you really have to be the expert in your own life and see if it's going to fit. because things like this really only work if you're able to do them at least 70% of the time. So why try to stress ourselves out and put all this extra stress on our life, trying to fit our life into something that it really isn't? It would be better to put that motivation and excitement for a health change into something that is more like movement or eating non-starchy vegetables.
Great. I have a couple questions here about using medications for prediabetes. And it's definitely true that there are a number of studies which use some of the usual medications that we use to treat diabetes earlier within prediabetes. One of these medications is kind of the workhorse of diabetes care. It's called Metformin. And while it's true that Metformin does help to prevent the development of diabetes in those people who are pre-diabetic, and it usually does that by causing those insulin receptors to become more sensitive. Even though that is the case, I tend to recommend that people go the lifestyle route first. That is, do what you can with diet, physical activity, as well as things like sleep and stress reduction. Now, the fact is that Metformin will work all that much better if you're doing the right things from a behavioral viewpoint. And I tend to reserve using medications like Metformin in prediabetes only for those people who are really having trouble and in whom developing diabetes would be a really important thing to prevent. So this may change over time, and there's some important medications that are coming on board which may also be available for prediabetes. But at this point, I don't prioritize that. Certainly some of my patients, I prescribe Metformin for prediabetes, but usually I reserve Metformin as a key medication once people have developed diabetes. There was a couple of other questions about measuring inflammation. And this is a brand new topic. And the fact is that we still need a lot more research in terms of what's the best way to assess inflammation. There are a couple of blood tests that do get at inflammation in a very general way. One is called C-reactive protein, and the other is called the ESR, or erythrocyte sedimentation rate. These generally look at overall inflammation within our body. And sometimes that correlates very well with things like diabetes or the development of heart disease, but not always. And probably what's happening is that it's a more specific type of inflammation that we can't necessarily measure precisely that's involved. So there are kind of these surrogate measures of inflammation. One is just the development of prediabetes. If you have prediabetes, there's probably some level of inflammation going on. Another indicator are within the lipid tests. The triglycerides is essentially fat that's circulating in our bloodstream. That tends to go higher with inflammation. And the good cholesterol, called the HDL cholesterol, tends to go down with inflammation. So I often use this ratio of triglycerides divided by HDL as one measure of just sort of that inflammatory process in people who are developing prediabetes or developing diabetes. I had a question here I thought I'd throw towards you, Leah, in terms of how can somebody who's of low weight and developing prediabetes, what's their best strategy? Because clearly they really shouldn't be losing weight or shouldn't be losing much weight. So what do you tell that sort of person in terms of strategies?
Yeah, that's a great question. It actually comes up a lot in my classes. So that is the perfect sort of thought around building muscle, so resistance training. So with those bands, I mean, it could even be like cans in your, if you have any cans in your house, or like a water bottle that's full of water. So really building your muscle mass and the lean body mass can really help lower blood sugar without causing the weight loss. Because you're right, in that instance, we don't really want to overly restrict and continue to lose weight. But another thing I would also challenge you to think about is how many whole foods are you eating? Are you eating more processed foods? Because sometimes people, I think if you're lean, people are like, oh, just keep eating, whatever you need to do to just keep eating to maintain your weight. Well, the quality of your food still matters for your inflammation and also for your body. So you're eating more healthy fats, avocados, nuts, seeds, brown rice, quinoa, things like that, lots of veggies, cooked in healthy oils. So things like that, I would say.
Yeah, I think that's really important to kind of make sure you're focusing on things other than the weight loss. And one factor here is that for many people, even without changing weight, physical activity sometimes results in a redistribution of weight. And if we can build more muscle and have less fat, we even can maintain the same weight, and that's going to be healthier. I really regret that we have so little time to get through such a massive array of really great questions. And I think we've in some ways only touched on some of the most interesting ones. There are other interesting ones out there, and I really regret that we can't get to those. This has been really exciting to be involved with this conversation, and I really appreciate the questions that people have. We're going to have to wind up now, but I would encourage you to go back, and several of the questions are kind of covered in some of Leah's early slides. And I want to thank Leah for her role helping out with this Living Better with Prediabetes session. And I want to thank everyone who attended for their participation. Thank you so much, and good night.
Thank you.